So one of the things we'll say is make sure that you don't add any sodium, and that we may talk to you about how much you want to get. Also, Dr. Williams had talked about managing your weight. It's very important to get some of that excess weight off. And we know that that cannot happen overnight. Nor are we telling you that you can't have, I know my community, you can't have fried chicken every day, but in moderation, let's cut back on it. And let's look at other ways that you can get some of your nutritional pieces in. We will be doing next week a nutrition demonstration, so come back next Wednesday, same time, to get some good healthy recipes. And then another thing that does affect your hypertension or high blood pressure is smoking. That is one thing that we want to make sure that people stop, and stop smoking is really bad for our arteries. We need all the oxygen you can get, and there's some tools and stuff to talk about how to be able to do that. So I'm going to ask Dr. Williams too. He talked about how long he had been there. Why are you so passionate about it? Uh-oh. We'll hold that for that. Gives you a chance to hold it.
You're right, you can think about that.
Hello, caller. Thanks for calling.
Hey, how y'all doing tonight?
We're good. How are you?
I'm pretty good. I got a question.
Sure.
For those of us who don't have insurance and don't really have a job, to say, is there a place you could go to get diagnosed and treatment if you have high blood pressure?
Well, as far as the diagnosis, you can go to any pharmacy. Again, Richmond Ambulance Authority and ambulance will check you. But any pharmacy has a blood pressure cuff. You can decide, you can get it checked and then decide where you can be seen. There's other free clinics around town, but that's what we're here for. We see patients without insurance at the Richmond Area High Blood Pressure Center.
So Dave,
give us a call.
Dave?
We're located at 1200 West Carey Street in Richmond. If you call
1200 West Carey Street in Richmond.
Okay, thank you.
And
you call 359
9375 9375.
Tell
359 9375.
Correct. 359.
359.
Right. 9375, right? 359 9375. Okay.
And we'll be there 8 to 5 tomorrow.
And tomorrow they're there from 8 to 5, caller.
All right. I appreciate it.
All right. We appreciate you calling in.
All right. Have a good one.
You too. Bye-bye. So now, what brings you back? You got a full-time job?
I got an internal obligation to do it. I didn't get here by myself. I feel like I need to return to the community, to some of the resources that helped me through, and not just for the African American community, the community as a whole are unaware of the consequences of not being treated. There are people who cannot afford to get treated or be seen. We make it affordable, make it literally free for them. And it does decrease cost over time. If you get in and get treatment, the cost of our treatment is low. There's, again, help from pharmaceutical companies. There's help from MCV, particularly Secours has been very helpful in allowing us to do this. But I do it because I just have an internal obligation to do it. And I've done it. I've talked about quitting some years ago. I can't do it.
I know, and that's why those who are really in the healthcare field, you just can't. You're drawn to really, and
can't walk away.
That really is our theme at Secours, good help to those in need. And I know I have a personal story, and probably, everybody does. Somebody knows somebody who has high blood pressure, cardiovascular disease. I had stroke. Both of my parents did die from cardiovascular disease. And my mother actually had a stroke. So it's real personal to me. So when I hear people aren't taking their medications and there are things that we can do, you definitely want to be able to help them to make the changes and the things that they need to be able to do. So, Dave, I know this is your real passion as well. And it's nice to go to work every day because you're getting that sense of fulfillment.
It is a sense of fulfillment. I'm the administrator. I'm really here to brag on the folks that do the work, who see the patients, who do the counseling, who do the treatment, who provide the diagnosis. And if I could, I want to read a short list. Dean and I were looking at it. And obviously we need to thank Dean, and there are countless patients who he's treated. We're never in a position to really thank him, and I get to thank him for them because we see them more often, because he can't be there every day. He's gotta live his life.
I get phone calls every day.
Yes, you do. Dr. Dan Carl is our current medical director, who took over. When I joined the organization almost 7 years ago, Dean said, "Yeah, I've been doing this 10 years. If there's someone else who wants to help out." So Dr. Carl stepped up and did that. Dr. Gear, Dr. Hess, Dr. DiGiovanni, Dr. Weisberger, Dr. Casala, Dr. Jose Weiser, they have all practiced and currently practice in the clinic. And then our clinical pharmacists who come over from VCU, Dr. Sisson, Dr. Van Tassel, Dr. Rodanko, and Dr. Dixon. They're the ones who are giving of their time in such a way that it means more to those patients than for those of us who currently don't have any cardiovascular disease. We can't identify with how important it is for them. To our donors, we are on the verge of expanding our organization, providing some more general medicine services, and making our structure more effective and efficient for the delivery of care. And I wanted to thank a couple, the Mary Morton Parsons Foundation, again, Bon Secours, the Virginia Healthcare Foundation, City of Richmond, VCU Health System, the various schools who provide so many students, the Robert G. Cabell III and Maud Morgan Cabell Foundation, the Richmond Memorial Health Foundation, and the Department of Health have all contributed in such a significant way that we wouldn't be here today without their help.
Great, great. I want to talk about, we've talked about hypertension and high blood pressure. I would be remiss if I did not talk about the signs and symptoms of stroke. I definitely just want to do that. I know we're talking about the preventative side as well, but if you have high blood pressure, and we use the acronym FAST for signs and symptoms of stroke. So F would stand for facial droop. A would stand for your arm or limb may be weak. S stands for speech. You may have slurred speech. Your speech may be confusing or garbled. And T stands for time. Time last known well. And I'm going to put them on blast. I know I'm the Neuroscience also administrative director. And last week we had somebody that came in with signs and symptoms of stroke. And Dr. Williams was able to give that person our clot buster drug within that 3 hours, and that person did very well. So not only should you know your signs of hypertension and what's going on, but know that we may be able to treat you if you do have a stroke. So it is of essence that you come in immediately. And Dr. Williams, you might want to talk about that as well, because you're on both sides of the fence.
Well, time is a factor. The window that's established now for TPA, a clot busting age, is 3 hours. But don't wait till 2 hours and 50 minutes to call.
Right.
You start having the symptoms, get in and get checked. But we can reverse certain strokes. Unfortunately, there's a hemorrhagic stroke associated with high blood pressure where you bleed inside the brain. You can't get a clot buster then. So these are for strokes caused by clotting stroke, not a bleeding stroke. But the drug does work if you meet the criteria. There's exclusion criteria depending on whether recent surgeries, tendency to bleed on blood thinners. So don't wait to use that. It's available. Get in and get treated early.
And I also want to talk about hypertension or high blood pressure is sometimes called the silent killer. And then you have a heart attack. So can you talk a little bit about that, why they call it a silent killer, and why, when you have a heart attack, you feel it, or,
Well, it's a silent killer because, most people don't feel symptoms. Some people have headache, double vision, blurred vision, some changes when they change positions, that is for headaches when they change positions, vision changes. The problem with hypertension over time, it causes strain on the heart, it causes you can have increased workload on the heart. The heart is supplied by coronary vessels. So you have increased cholesterol plaque, you can have emboli in the heart, will cause a heart attack. Has decreased blood flow to a certain segment of the heart. And you can have consequences with dead heart, if you're not seen early, that is fibrosis, scar tissue. You can have arrhythmias. The heart just doesn't blow up. You have arrhythmias or you have heart failure as a consequence of damage to the heart. You don't want those things to happen. If they should occur, if you have chest pain, if you look at the causes, the leading risk factors for heart attack, it's age, it's family history, it's cholesterol, it's hypertension, diabetes. Those are the things that you have to worry about that can combine and cause a heart attack.
And we didn't talk about cholesterol, but that's another thing. I'll just
And cigarette smoking.
And cigarette smoking. But I want to say I always give my quick pearl on cholesterol, and then there are two we really look at. LDL, I call that lethal, and you want it low, okay? You want it low. You want it under 100. Your HDL is your healthy one. You want it high, and you want that over 40. So again, lethal, low, healthy, high. Okay, and you can just, you know, now all the internet world, Stephen, they can go and Google and get all that kind of stuff. But I wanted to talk about cholesterol is not good. It really blocks up all your arteries and makes it really bad for you as well. So Dave, 30 years, what's in the making for the center? What's in the future, and what's going to happen this year, and what would be on your wish list?
Oh, my wish list.
Yeah.
That's
you never know who's
more
listening.
doctors, volunteers,
Exactly
right? If we had more time, I'd pull out the full list. But Dee's exactly right. We always need more practitioner assistance. The better the expertise, the better the outcomes. The more time spent with practitioners, the better the outcomes. The lay volunteers who help at the front desk and fill those gaps that we don't have. We have a very small staff. We have a couple of nurses. We have an administrative component. I'm the administrator. I'm the financial development department. It's a short wing, and I'm the only one on it. You know, without the assistance of these volunteers, we couldn't extend the hands of the experts who we work with and provide all the services that are currently provided. So that for sure. We're always looking for more diagnostic equipment. Being able to send patients home with blood pressure monitors so they don't have to wait or they don't have to hesitate because I don't want to go to the fire station. Creating that awareness for the patients just so they can check their pressure anytime. Putting it into the website for the Get to Gold program. There are all ways that they can improve their own outcomes. We have a short list of medical supplies that we need, from gloves to table paper. Anything that we have to spend money on that doesn't directly provide care is something we'd like to provide for in a different way. We'd like to have donated. We are in the process of working through an expansion, so we're going to be looking for additional equipment there, furnishing as well, but we always need those dollars to fund the infrastructure. We can recruit the volunteers we do because there's an infrastructure to support their efforts. It's that complement to the skill they bring to the table.
Now, we know it's called the Center for High Blood Pressure. However, you do a lot more than that. I mean, I was in a maze when I came down to the center last week. Another component to this with hypertension and cardiovascular, in particular in stroke, is diabetes. So can you talk about some of the services that you do beyond just blood pressure? You do some other things as well.
Do you remember when diabetes was officially entered into the rolls as another?
Yeah, I was against it initially, but it's important.
It is important, and speaking on your behalf, I think one of the reasons it wasn't something we felt we were in a position to treat consistently is because, especially with someone who is requires insulin treatment, we didn't have all the expertise we needed.
Okay.
When we brought in the additional practitioners, the clinical pharmacists, and a gentleman by the name of Dr. Evan Sisson, who's got an extensive background in the treatment, the therapies around diabetic treatment, we had a greater, I would say, a better team with which to handle that, because we couldn't get any more of Dean's time, but how do we complement what he does with his diagnostic skills and things like that with other practitioners who are experts in medication? And so it was a good fit. And so the number of diabetics we're treating, and I would say that one of the reasons we've increased our patient load 15% from the previous year is because we have that many more diabetics. And not to mention 8%
It's huge in the
overall.
clinic. And I think if you look at the average patient, particularly if there's any obesity or family history, if they're not diabetic, they will be diabetic after a few years. And if we can mitigate their bad changes in health with controlling the diabetes and hypertension, we keep them alive. And with look at the risk end product as far as hypertension, that of heart attack, stroke, kidney failure, diabetes is right there. You can't separate it. So we had to deal with it. I'm glad we did.
Yeah, it's been great for the patients. And then the hyperlipidemia or high cholesterol. It's rampant. Yeah, there's great drugs for it, but there's side effects too.
Right.
It's always a downside. And remember, I think everyone out there needs to be reminded that you only control a third of the cholesterol in your system. The other 2/3, the old liver's producing for you. So when you're talking about dietary changes and things like that, if cholesterol is too high, that means that just changing the diet's not going to fix it. You're going to have to change the diet, you're going to have to change lifestyle, you're going to have to change smoking, all those things in addition to getting treated by this guy.
And true, and I'm going to come back to Dr. Williams, and he's going to say, oh my goodness, this girl is on me. But I want to talk about medication and compliance. That, I think, it is so important. And when I am out in the field and hearing people, I said, why don't you take your blood pressure medicine? Some may say, I can't afford it. The others may say, I don't like that side effect. I was like, have you had the conversation with your practitioner? So can you give some lessons of talking about there are so many blood pressure or options, but how can somebody, and again, some people just don't know what to say to have that conversation. And you all talked about the center and it being a program and family. Talk about that dialogue and talk about you might not be able to be off of blood pressure medication. And so we want, though, at the program, quality of life. So how can we start that dialogue?
Well, my grandfather's blood pressure medicines are not what we have today. There's much better profile of medicines out there. It's hard to kill a bad rumor. And so older people have told younger people, don't take that. This will, erectile dysfunction, fatigue, mostly the erectile dysfunction for men. They won't talk about it. But they'll tell me. They won't talk about it to the average person, but they'll tell me. Feeling tired or fatigue from certain medicines. That's true with certain medications, but there's options available. There's medicines in the angiotensin category, the angiotensin blocking agents, ACE inhibitors, not the same side effect profile as the beta blockers. We have choices now. And the problem is, if you really don't, everything's got consequences, as Dave mentioned. The failure to treat will cause problems later. So which can you live with? The little fatigue or some inconvenience versus in a nursing home, having a stroke, being incapacitated. You have to have that conversation with them.
Yes.
But there's various categories out there now that weren't available 20 years ago. So I encourage you to come in and get treated, get assessed. We can work with you. If this doesn't work for you, we can choose a different drug.
Okay. And as somebody out there also in the field, teaching, I guess, the public of, again, to have that conversation with you and to be proactive and say, when will I see some change? I think sometimes people just don't want to know. So being able to have that dialogue, I think, is real important as well. Dave, have you heard any barriers, or you think that you've been there for a while, of what people hear, why they don't take their medicines? Or
There's really 3 primary reasons.
Okay.
Part of it is transportation. Again, I can't get to the place to pick up my meds. I can't get to the place where I need to be treated. Part of it is resource, for sure. I can't afford the medication therapy or whatever, the testing strips for my diabetic situation. And then finally, I don't understand it well enough. I don't understand the disease process. Why is it such a big deal? What's it really going to do? So we spend a lot of time trying to break down those barriers. And I was thinking about adherence to therapies. Stephen, what is the perfect exercise?
The perfect exercise?
Yeah.
There is no such thing.
The one you'll do.
I know.
Yeah, right?
That's my favorite.
What's the
line
perfect
that I
therapy?
learned from
The
you.
one you'll follow.
Absolutely.
And so when what Dr. Williams is speaking to is we know there are a lot of therapies out there. And if we can convince them that there are, then we can negotiate a therapy that is effective and affordable. That's the thing. You can be the greatest physician in the world, have the greatest medicine in the world, but if you don't understand how to take it and can't afford it, what's the point? And so we fight that every day.
Dr. Williams, stress.
Well, I can tell you this. People in the cemetery don't have stress. Stress is part of living. Stress is just part of life. You know, it's a matter of balance and learning how to deal with it. We spend a lot of time accusing stress, but there's, particularly, there's things you can do. Exercise helps. Relaxation techniques are available, but you gotta try. You try to stay away from your drama. And we talk about in America how stressed we are. Well, we're doing pretty good compared to the rest of the world. Keep it in perspective.
That was my perfect. I love just keep it in perspective. Keep it in perspective.
I saw a piece years ago, and it was a list of 100 items that an emergency room physician put down as the things that weren't really stressful. And it was a list of the things that were really stressful. And he deals with that every day. And we try and prevent people from becoming part of his day and what he does. Real stress, real emergency, and the chance for death or disability, he deals with every day. I think people need perspective nowadays. What is it really that stressful?
We're not in a war zone. We all probably eat fairly well.
Yeah, exactly.
Okay.
A little perspective.
All right, so let's talk about the center again. How can I get there? Hours, times, places.
Perfect. Currently, we are open from 8 until 5 p.m. Friday, we're open from 8 to noon. And we have an evening clinic we operate with a partnership with the VCU Health System Medical School. And that's happening on a semi-regular basis once to twice a month, and that's in the evening. We are right on the edge of the VCU campus, located at 1200 West Carey Street. We are in the middle of all these other counties and locations. We serve well beyond the borders of the city of Richmond. We have patients who come from Hanover. We have patients who come from Chesterfield, Goochland. We have a patient who moved to Fredericksburg and for years continued to drive down just because of the way he was treated.
Wow.
And I couldn't believe it myself until I met him. So if you're looking for a way to get treated, if you're looking for an education class, our education program is open to the community, whatever you're looking for. But if you hadn't needed our services, you may not know that. So give us a call, 804-359-9375, and we'll answer the phone, I promise.
And that's good to know. We're almost wrapping up. We have 5 minutes, so I do want to go around to each one of you and talk about what it is, your last thoughts on the Center for High Blood Pressure and Hypertension from your perspective, Steve, and talk about your program again, why you think that will work to help with hypertension, blood pressure.
Out of all the internship sites, I chose the Center for High Blood Pressure because majority of our population are these people with chronic diseases, the stuff they can modify. If they modify their lifestyle, then they could control it and maybe reduce their medications and hopefully get off of it one day if they strictly monitor their nutrition and exercise and just small things like cut down on smoking and stuff like that. Just get off the couch, stop eating chips and stuff, sugary stuff. Sugar, fat, and is the key, one of the biggest things in everything in America, all the food and everything. We're addicted to that taste,
Dave, and feel free to shout out your board of directors, and we want to thank them and everybody, whoever had that vision 30 years ago. I'm
absolutely
in awe.
A lot of facilities, clinics, private practices, we know that 50-60% of the work that they do is around chronic disease. They became chronic disease managers by attrition rather than design. Whereas the guys who put this organization together said, we're going to build an organization based around the biggest issue that we're facing in this community, and it's hypertension. It's the primary diagnosis in almost every emergency room, every clinic. It's rampant and it needs some resolution.
Dr. Williams?
Well, I really can't trump these guys, but I can say that it's important that I've been involved. I want to continue to be involved because it makes a difference. Lots of people a lot of the people I see, I've seen over the years. There's patients I started with 10 years ago, 15 years ago, okay, 20 years ago, that I've taken care of. It's been a pleasure working with the staff at the Richmond Area High Blood Pressure Center, the Center for Excellence in Blood Pressure Control. It's been it's been easy that we have support with the pharmaceutical companies, and particularly Bon Secours and MCV, and the MCV faculty that have helped out. It makes it easier for me. And again, I can't walk away from it. It's my obligation. That's what I do. I do healthcare.
Well, I want to thank you all for being here. And I just want to say this, and you can kind of see it from this show. It takes a community. It takes a community to help a community. And hypertension 1 and 3 is a serious problem that we can together be able to change. And so I'm going to challenge everyone who's listening, everyone who will hear this, to just go get checked. To get checked and to know that the Center for High Blood Pressure, if you don't have insurance, if you just want some information, if you want resources, there are ones that you can be able to reach out to, as well as Bon Secours, who is good help to those in need. You know, as a community, again, in Richmond, you have a big pearl, and that you have a center that will help you with that. They're going to be celebrating 30 years, and we hope we actually don't want you to have 130 years more, because we want to beat this. So again, we want to thank you for tuning in tonight. Next week, we will continue our series as we talked about hypertension and risk for cardiovascular disease. We're going to do a cooking show live with Wanda with some healthy tips for you. I'm not going to tell you what her recipe will be, but you better tune in. Thank you, and I'll see you next week.